Welcome to the Healthy Happy Human Show. This is one of a kind.
Hello everyone, welcome to a very exciting episode of the Healthy Happy Human Show.
The Healthy Happy Human Show is here to help you attain physical, emotional, and mental well-being.
Hi guys, it's your favorite host Skills, and welcome to another exciting episode of the Healthy Happy Human Show. And today we have a very amazing guest with us in the studio. It's no other person than Dr. Moka. Dr. Moka, it's a pleasure to have you, and you're welcome to the Healthy Happy Human Show.
Thank you. I'm very happy to be here.
You're welcome. So today we will be talking about a very interesting topic. It's called BPH. Dr. Moka, what is BPH?
So BPH stands for Benign Prostatic Hyperplasia, and it's essentially the growth of the prostate gland. The prostate gland is a gland at the base of the bladder. It surrounds the urethra, which is a pipe that passes urine from the bladder out into outside of the body essentially, and it's most common in older men.
Okay, very interesting definition. So can you tell us about the people that are at risk of contracting BPH?
Okay, the prostate gland is only found in males, so men at risk.
Okay.
And then it's very common in older men. It's estimated that about 90% of men over 90 will have a sort of prostatic enlargement. In addition, there have been other risk factors like obesity. People that have higher body fat are more likely to have BPH. Then people that take a lot of alcohol and caffeine are also at risk. Smoking has also been shown to have more severe BPH symptoms. In addition, hormonal changes that happen with aging have been also shown to predispose people to BPH.
Okay, interesting. You mentioned that it's mostly common in older males.
Yes. I also forgot to mention that it's also common in African American and black people. So being a black person increases your risk of having it.
Okay, interesting. So I'm just curious, is it hereditary? Can it be transferred?
Yes. If your father had it and your grandfather had it, the chances of you having it is high.
Okay, interesting. So let's talk about the symptoms. What symptoms would a person with BPH come down with?
Okay, the symptoms are really related to the position of the prostate gland. It's around the urethra, so almost all the symptoms are urinary.
Okay.
So you have a change in your urine pattern. So when you're getting older and you notice these things, there's a chance that you may have an enlarged prostate. So there's usually increased urinary frequency. Okay. So you need to urinate more in the daytime and at night. So if you notice that you're waking up more times in the night, you can't sleep as much as you used to, then you should probably see your doctor. Another thing that can happen is when you go to urinate and you want to start the urination, you can't start it as you usually do. It takes a while for the urine to come out. Then you may need to strain, you may need to push for the urine to come out. In addition, when the urine is coming out, the stream, so the force that the urine needs to come out with is lower, so there's weak stream. In addition, there's maybe when you're done urinating, you may feel like you've not really emptied this bladder. You've not been able to empty everything in your bladder. That's another symptom. Then when you finish, you may have some dribbling on your underwear. So there may be urine on your underwear when you finish urinating. Then you may have to urinate more frequently. So because you felt like it's not empty, you may have to go again.
Okay.
In addition, you may get more urinary tract infections because actually the bladder may not be emptying, and it's also a source of infection to grow. Urine is a great source for bacteria to flourish. Okay. These are some of the symptoms.
Interesting. Thank you so much. It's been very interesting having you. So also, how can this be managed? How can BPH be managed?
So there are some lifestyle modifications you can do, also some medical treatment. Okay. Lifestyle modifications include reducing your alcohol and caffeine intake, because these are things called diuretics. They make you want to urinate more frequently. Then also reducing the amount of water you take, especially at night, so that you don't have to wake up as many times in the night. In addition, you can have like a timetable. So every 2 hours, I'll go and empty my bladder. This can help with the symptoms of the frequency and the feeling of fullness. In addition, you can watch your diet, eat healthier, and exercise. This has been shown to improve the symptoms of BPH. If these don't work, your doctor can also prescribe some medications for you. And last but not least, there's also surgical options. You can have surgery to relieve these symptoms.
Okay, interesting. So earlier on, you mentioned that older men are at risk of contacting or having BPH.
Yeah.
So when you say older men, is there an age range?
Usually men after 40 start to develop some symptoms, and there are some tests that they do to know if your prostate has started enlarging. But just because your prostate is enlarged doesn't mean you may have symptoms. Some people have an enlarged prostate without symptoms. So the people that need treatment are those that have symptoms.
Okay. People that need treatment are those people that have symptoms.
Yes.
All right. This is very, very informative. Thank you so much, Dr. Moka. It's been a pleasure speaking to you on this episode of the Healthy, Happy Human Show. So before we let you go, what are your final words to our audience out there who are listening to you?
I'll say thank you for listening, and I hope if you have these symptoms, you will go to the hospital first and not try some other alternative treatments, because those may or may not work, and it's better to have a confirmed diagnosis before you start treating anything.
Okay, thank you so much once again. It's been a pleasure having you. All right, guys, you've heard it for yourself from Dr. Moka. Make sure you get tested, be conscious of your health, and do not try to self-medicate. Always seek the advice of a medical professional. This is your favorite host, Skills, and if you have any questions, don't forget to leave them in our comment section. And also, do not forget to subscribe to our YouTube channel for more engaging, informative, and thrilling content. And also follow us on all social media platforms at Healthy Happy Human.
Welcome to the Healthy Happy Human Show. This is one of a kind.
Hello everyone, welcome to a very exciting episode of the Healthy Happy Human Show.
The Healthy Happy Human Show is here to help you attain physical, emotional, and mental well-being.